Hey, we can't leave without talking about the debate that's starting to rage in Washington this week over plans to repeal and replace Obamacare. The new House plan would cut the fines for people who don't have health insurance, and instead of income-based tax subsidies, there would be age-based tax credits. Well, Democrats, including Michigan Congresswoman Debbie Dingell, they're vowing to fight the changes. Even some conservative Republicans don't even like this. Stephen, what do you make of the debate that's shaping up in D.C. right now?
This is a strange bill in that it doesn't really solve as many problems as it creates in terms of creating more uninsured people, throwing more uncertainty into what is already an uncertain market with this marketplace. You know, there's a reason that everyone in the medical establishment has said this is not a good idea. Maybe they just think this is a starting point, right? I think we should try to keep an open mind and say, all right, if we start here, where can we get to? But this bill, as it's crafted, and they have, you know, pushed away every single amendment that Democrats have tried to offer in the committee. It's junk. I mean, it's garbage. It's making a system that has real problems worse rather than making it better.
Is it junk? Is it garbage? You even have some Republicans holding their nose on this one, Nolan.
Well, you have the conservative caucus saying they won't pass it. But one thing both the conservative Republicans and the Democrats have to come to grips with, something has to change. We are now in a situation where 1/3 of America is covered by just one insurer on these Obamacare exchanges. And in some states, Tennessee, for example, 16 counties, you can't buy insurance on the exchanges. So this argument that, well, Republicans are going to throw 20 million people off their insurance, those people are going to lose their insurance anyway if we don't fix this. I think it's a starting point. The president and Paul Ryan have said that. There are some good ideas in it. I think turning more control back to the state. I think they should bring the governors into Washington and participate in this.
Well, because there's a lot of questions about the Medicaid expansion, and they want to know how that is going to work.
I think you should hear from governors like Rick Snyder and John Kasich, who have done innovative things with the Medicaid. But we've got to do something, and the first thing we've got to do is stop these political fights over this issue, because this is a real quality of life issue for Americans. When you have families out there paying $12,000 to $18,000 a year for family health insurance, they can't save for college, they can't save for retirement, they can't meet their basic needs. And we've got these folks down there in Washington, you know, making political hay out of this while Americans are suffering. Insurance does you no good if you can't afford to use it.
You got last 15 seconds.
Yeah, I mean,
last word.
The problem is that we've never had a mature conversation about this in Washington. The Republicans threw rocks.
You don't have faith that we're going to have a mature conversation about it now?
No one seems to have the appetite for it. I mean, the Republicans threw rocks at this thing for 6 years under Barack Obama. Now Democrats throwing rocks at what the Republicans are doing. No one's talking about what no one's talking about, which is, how do we come up with a way to insure people and lower costs? And that's difficult. It's more complicated than anybody has suggested yet.
All right, we will keep watching. Thanks, guys. It's always good to see you. And that is going to do it for My Week. Thanks for joining us. Remember to find us at myweek.org and on Twitter and Facebook during the week. We'll see you next time. Take care.